I just wanted to introduce everyone to Dr. Renata Maricevich. She is the program director for the Integrated Plastic Surgery program at Baylor. And she originally trained in Brazil, and then she trained at Mayo Clinic and at the University of Pittsburgh. And now she works as a craniofacial plastic surgeon. So she's really involved in plastic surgery applications, and especially she's here to talk to the Latino Plastic Surgery Society about, applying as an underrepresented in medicine student and what we can do to stand out in our applications. So whenever you're ready, thank you so much for joining us.
Absolutely. Thank you. Thanks, Isabel. So thank you for the introduction, and I'll talk a little bit more about my journey very briefly. My biggest disclosure is I have no idea about any secrets to get into medicine, to get into residency, and to do whatever you want to do. But I try to go over a little bit what I did and what I see people doing, and a little bit of what I'm looking for a bit about it. Just 1 second. So a little bit of my journey. As Isabel said, I was born and raised in Brazil. And you're going to see somebody just walking in because I asked my husband to take care of her, and she decided not to actually do it. And after doing my medical school in Brazil, my husband and I decided to actually come here to do training. We had no idea what to really do and how to get there. But we just kind of started looking for people, reaching out to people, sending a bunch of emails to a bunch of different people. And we were able to come to Boston first. So I did very limited research at MGH while my husband was actually doing research there. And then I matched into general surgery at Mayo as a prelim, stayed as a categorical resident at Mayo as well. And then I stayed there for 3 more years and did plastics there, so that if you calculate it, it's 8 years at Mayo. And it's cold, it's awesome. And then I did a craniofacial in Pittsburgh and stayed there as an attending for a little bit until actually my husband matched at MD Anderson for micro fellowship. And then I actually came to Houston, got a job here. So a lot of it you're gonna hear like about my husband. We're both general surgeons in training, and plastic surgeons in training. He did micro and I did pediatrics. So he's also from Brazil. He was born here, but just spent here 1 year, and then was raised in Brazil, and we kind of did the same path. So I guess we're both Latinos too. So why me? I have no idea why Isabella actually reached out to me. I guess one of the reasons is because I'm actually very involved in education. I did come from Brazil, but again, I have no idea on how to. There's no real secret, and there was no real mentor for me for many years to figure out. So you guys are a little bit of an advantage because now social media is so out there and you can reach out to people very easily. So you for sure should take advantage of that. So the first thing that I want to talk about is that you have to make sure that actually that's what you want. First of all, you have to know what plastic surgery is about. Plastic surgery, as we see in Instagram and all this stuff, and you're gonna hear a little bit about this because I'm not on Instagram at all. I tried to do something in Instagram for a couple months and it didn't really work out because I have very little to no patience. Plastic surgery is not necessarily what we see on Instagram. It's not all about the post-training and all of the cosmetic stuff that is posted out there. Plastic surgery is a very broad field. So you have to understand what it is before you make a decision to go into it. It's very cool. We do a lot of really nice stuff. It's very fancy. A lot of plastic surgeons are actually out there with like fancy people as well, but it's not all about that. So, and why do you really have to make sure that you have to make sure that you know, so you have to make sure that actually you love it. Because if you don't love it, it's definitely not worth like 6 years of your training plus fellowships if you're going to go into, and a lot of sleepless nights. Also because it's now, according to this year's Medical School Insiders, is the most competitive field in medicine. And we're talking about all medicine, all surgical and medical specialties. And that's based on what you see there, match rank step 1 scores, that we're going to talk a little bit about that. Step 2 scores, publications anyway, in the top 40 in age. Also, just from the American grads, but 20% of them were not able to match into plastic surgery this last year. So all the positions are filled. You see there what the MD senior, MD grads, DO, and US and non-US IMGs. But there are a lot of people that actually stayed out of that. So it's extremely competitive. We had last year 360 applications for this. So a lot of people go unmatched. Not to scare, you just have to make sure that you know what you're getting into before you actually do it. Also, another thing that you want to figure out is like where you want to be. If location is extremely important for you because of your family, because of weather, because of whatever it is, you have to figure out where you want to be. And then you might not have in that location the plastic surgery programs that will fit your expectations and your needs. As you can see there, we kind of been everywhere. We lived in North and South. We go kind of bit with the family. We carry the family around. So how to become competitive? How to be competitive? Focus. No question that focusing on what you're doing and what you're going to be doing for the next months, years is key. And the focus is important, but do not lose the big picture. And we're going to talk a little bit about it in a second. So again, I have no secrets about that, but for sure the one thing that you're not going to miss out on is work hard. So I'm going to tell you a little bit of what happened to me when I first came to this country. So as I said, I was in Brazil, I was doing medical school. And just like you do away rotations here, we didn't really have that there, but I came to do elective rotations in here. I had no idea what I was doing. We had no idea that we didn't really have really great internet then. I know that it sounds really old, but it's true. So we emailed, like speed dial email, whatever it's called, 200 places and said, hey, I really want to visit your place. Do you have a spot for 2 medical students who want to rotate there? And we got 10 responses back, which I guess was pretty good. But it's like, oh yeah, fill out this application. We had no idea how to fill out applications and anything like that. So we ended up coming here to 2 different institutions. We were just curious to see what was actually going on. We had no clue that people actually did that to look good. And we came right about when you guys do rotations, which is about summertime, because you want to get to be seen so you can apply in September. So we were curious. We really didn't know any medical English whatsoever. There were no electronic medical records whatsoever. So we would spend the evenings and the nights looking through the charts to figure out what they meant. You take for granted, like, what is DVT? What is H&P? What is HPI? We had no idea. So we just looked through this, we learned all the system, and we spent 3 months and we thrived and we did really good. Fine. We left, we went home. When we went back to Brazil, and the idea was actually to do residency there, we said, you know what, this isn't gonna work for us. I think we actually should train the US. But we had no idea about the application, how the application was. So what we did is that we reached out back to the people that we worked with the evaluation that I had done in the rotation evaluation. And he said, I guess we need a letter of recommendation if you're trying to apply. If you remember us, would you write a letter? And we put a little photo, like a little, tiny little photo on the side. And they're like, happy to write a letter. That's how we got into residency here. We were not trying to show off. We're not trying to look good. We were just trying to really work hard and learn. And that's all we did. And here we are 3 years later. So start by being curious about plastic surgery. You don't have to be a PhD in plastic surgery. But if you see something that you say, wow, what are they doing? Why are they doing that? Start looking it up. Go, you guys have a world of information in PubMed, in your school, in books, in everything that you pretty much can think of. Curiosity will lead you to really, really to the right path. So, and everybody's going to ask about research. Yes, I think research is extremely important. I'm going to talk a little bit about that in a little bit. So reach out to attendings in your program, even if they're not in plastic surgery, even if they're not involved in plastics, because a lot of things, let's say that you don't have a plastics program, in there, but you have a breast surgeon who does something with a plastic surgeon in the outside world. You can do breast reconstruction stuff. You have trauma. Who's going to be taking care of that trauma? Somebody else. So start reaching out to the attendings in your program about it. If you do not have a home program, there's no problem. Not only you can reach out through your people, you also have, if you do not have a home program, ACAPS has an orphan program that you actually can be matched with other people in plastic surgery programs. I'm actually a mentor for a couple of people in these orphan programs, and they will reach out to me. We meet every now and then, so we can talk about how to increase their chances and improve their CV for their plastic surgery application. And then you're going to ask me, do I need to take time off for research? Well, it depends. Is it great to take time off for research? Yes, but you also have to figure out where you're taking that time off. If you're going to be taking a year off and you're going to publish nothing because that program doesn't have a strong research output, you just spent 1 year and we have nothing to add to your CV. And on top of that, when people look, oh, this person took a year off, but they produced nothing. Well, that really doesn't look very good. Taking 2 years off, if it's something that is on the plate, I think it's a great idea, because in 2 years, you can accomplish a lot more than a year. A year, you have to be in a program that you have to get in, and the process is already started. You actually joining projects that are ongoing, so you can get them finished by the time that you apply. Some people take time off even earlier than that, in their first year or second year, even before they start medical school, which I think is insane. But time off for research is really depending on what your worries are about timing. I trained for 9 years in addition to research time, so I guess I don't have really a time rush, but some people do. So that has to be kind of based on your kind of lifetime timeline. So again, the clinical grades is always important. They're always important. But not getting honors in every single rotation is okay. I'm getting a lot of pushback. There are sometimes like second-year medical students that come and rotate with us, and they did not get honors. So think about this. What do you need to do to get honors? You have to know about it. You have to understand it. You have to know how to take care of the patient. How do you expect a second year to do that? I don't. A high pass is amazing for a second year student, because they are at the level where they should be. In plastic surgery and in actually all the residencies, we have something called milestones. And we use the milestones to grade where they should be in their training. So it's milestones, they're graded from 1 to 5. 5 is like, they have to be experts. Most attendings that I know of are not 5 in everything of those things. So I don't expect a second-year resident to be a 5 in head and neck reconstruction, because they've not been there. They haven't done it. It's the same thing for the clinical grades. I do not expect you to be honors if you're still learning, because that's not expected of you. I'm not expected to know to take an in-service examination in head and neck now and get 99th percentile, because I do not do head and neck cancer. Well, I do, but I'm just saying in general. So clinical grades are extremely important. We look at them, but we look at them to analyze you as a whole, not to exclude you. So if you do not have honors and everything, it's okay. Another thing that I actually don't think is very fair is the dean's letter And some of the clinical grades, what they sometimes the medical schools bring us a huge report about their clinical grades and how they did it. The dean's letter is 10 pages long, and the next door school dean's letter is 2 pages long. The clinical grades don't have any explanation. So how am I going to compare this? So you have to put that in perspective. And I do that when I'm analyzing an application. So be active in societies. I think is extremely important for you to actually get some kind of leadership role. It doesn't have to be, you don't have to be the president of ASPS resident or medical student forum, but be involved, because we are looking for people who stand out somehow. And sometimes these leadership roles, you don't really have to do a lot of it. It's some work, but it's not for you to have in a piece of paper. It's for you to be able to tell whoever you're talking to what your role is in that society, in that association, in that place. Not just to put in a piece of paper, not just to put an extra line in your CV. Because when we start asking you about these leadership roles, we're going to be wanting to know what you really do, not just like a made up thing that you had there. ASPS is a great way to start. It's free membership for students and for residents for most of the time. So I would say that get involved with ASPS, because there are a lot of things that come out of it. If you have a specific interest in in the Microsurgery Society, you can actually enroll in that too. You don't have to go necessarily to the meetings, but it's nice to go to the meetings if you have something to present. But just being there, they have a bunch of webinars, they have a bunch of different projects and little groups in WhatsApp and all that stuff. So you can get involved in connection network with people. And the last thing is be interesting. And I'm going to talk a little bit about that with the paperwork when we put the paperwork together. Being interesting means medicine is not everything. You saw my 3-year-old just walking in here. That's my life. We just got a puppy. Bad idea. That's my life. I like working out. That's my life. I like traveling. That's part of my life too. So being somebody who is just thinking a little bit outside of the box, not only to medicine, is extremely important. I am super work hard, play hard. You have to find something that outside of medicine that will make you more interesting in medicine. So when I'm evaluating somebody in an interview process, and this is my secret, and some of you might know because I see a couple familiar faces, but the first thing that I do is I go to the last page of the CV and I see that little box that says interests. Because by the time that you guys get to interview with anybody, you've already gone through a big, hard process of selection, right? So you guys are smart. You guys worked everything out really well until now. You worked hard until now. But there are a few of you that are in the same situation. Can I be with you in the operating room for 16 hours when the flap goes down and talk about something that is not flap? That's what I'm looking for. Are you a normal person? So that's important. So I know they're gonna ask me this. So step 1, pass or fail. See, I have a normal life. My mom's calling me a WhatsApp. So the pass and fail, most of us have no idea what we're going to be doing. I have an idea. I am not going to use any step scores whatsoever this year, starting this year. Step 1 scores. And the reason for that is because I don't think it's fair that I use a cutoff. So it's a cutoff to exclude people from my list of evaluation of CVs, while somebody has a pass and fail, and maybe that person that got a pass had a step score of 210, right? So I don't think it's fair, so we're not using it at all. Some people are using it, so then people ask me, well, so what are you going to be using step 2? And I said, I'm actually not going to use step 2 because a lot of students do not have step 2 scores. So unfortunately for me, we don't have this objective data anymore. I never liked using this data because some people are just bad test takers. I did really well in one of my steps. I didn't do that great in the second step. If they had used a cutoff, maybe I wouldn't actually have gotten in. I would have matched today anyway, but just in general. But I am not using the step one. We have a paper that came out about this now. I think a lot of our programs are not going to be using it. It's going to make it harder for us to screen the applications, but I just don't think it's fair that we're leveling people differently. We're actually comparing apples and oranges with people that have STEP scores and do not have STEP scores. So then I think the away rotations and home rotations become more important. Because again, we're not screening with numbers. I can screen based on how many letters you have. I can screen how many research projects you have. I can screen based on what school you're coming from. I don't, but we can. So when you're doing your away rotation and your home rotation, work hard. Figure out how to be helpful without being invasive. It's very bad for the student that comes through and they're just trying to shine more than the intern. The intern has already done that. The intern has already shined to be there. So just be helpful and find a way to be there without being intrusive. It's a lot easier to say than to do, because you want to be there. You want to make sure that your face is there, that you know how to cut, that you're proactive. Ask the resident that we're going to be working with, ask the attending, what's the best way that you can utilize my services and my knowledge? Halfway through, ask for feedback. How can I improve? Don't ask like, am I doing a good job? That's not the case. How can I do better? What can I do to improve my surgical skills, to improve my communication skills, to improve my position in the OR? Read the room. Read, if the patient is bleeding, not the right time for you to actually talk about blood transfusion in the operating room. If the patient is coding, not the right time for you to say, I know the dose of epi. Not the right time for that. Read the room. Figure out after a big case that you couldn't really ask a lot of questions because it was just tense. Hey, I thought this case was really great, but I came into the room thinking about this and this and this. I didn't have the time or the chance to ask about. Can I ask you a few questions now? Perfect timing, perfect please. So do not force to fit in. One of the most annoying things that we can get, not me, because that doesn't bother me anymore, is when the residents give us feedback and say, yeah, they're just trying to be too nice, too present, too in my space. So meet the right people. As I said, ask for feedback halfway through. Usually meet the program director if you have the chance to meet the program director, or meet somebody who you just worked with a lot more, even if it's not the program director, and ask for feedback halfway through, or ask for a letter. I would highly recommend that you ask for a letter later in their rotation. It is very awkward when you meet for the person for the first time, first meeting that you had with them, and they're like, and can you write a letter for me? You might even say, I know it's going to be a little bit early, but depending on how I do here, I would love to have a letter from you if you're okay with writing that letter. That's okay. And also, if you are rotating somewhere and you're late, let's say that you're rotating that in September, the letter is due. We know it. We've been there and we do this all the time. You say, I know that we haven't worked together. I will need the letter. Would you feel comfortable if halfway through get feedback from the people that I work with and write a letter based on that? That's perfectly fine. But just don't jump into, had a couple students that literally the first day of rotation is like, and I need a letter from you. It's like, okay, yeah, I'll be happy to do one, but let's first work and then we'll do it. We don't have problems with bringing letters. You also don't want to get a bad letter, right? So if you're feeling that things are not going the right direction, have them give you feedback and say what they're going to be writing about it. I've had a few students, and not too long ago, that I said, I'm happy to write a letter. We've talked about your feedback already. We haven't really worked together a lot. I'm going to write a letter based on feedback that I'm giving you because that's what I got from the people who work with you. You have to understand that it's in between the lines. The letter might not be the most exceptional letter in the world, saying that you are the most exceptional student in the world. It is a letter. I'm never going to say anything bad about somebody, but it might not be the strongest letter. So if you have options, maybe you shouldn't go for that letter. So read the person, read the room. It's very simple. So that's what I look for in a medical student. And you're like, what? Yes, that's what I look for in a medical student, because that's what I look for in anybody. But again, that's based on your level. I'm not going to ask you to have a technique of an attending when you are a medical student. You should be knowing how to hold the needle holder or hold the suture scissors. So most importantly, that's what I'm looking for. Can I trust you? Can you work with my team? How's your communication skills? And are you passionate? That's what I want to do. That's what I want to know. So finding the right place is a little bit of a tricky thing, but just like I reached out to 200 people when I was coming here to actually rotate, reach out to people and stay in touch. You do not have to meet with them every month. I had a few medical students that wanted to meet with me every month. My schedule's a little tight for that, so that's not possible. Stay in touch. If you're interested in research with that person, stay in touch. Every few months, say, would you mind, meeting with me in a couple months so we can look at my CV to make sure that I'm in the right path? That's perfect. Reach out to residents via social media. Look at places that you're interested in and go into their website, go to Instagram and figure out if what they're doing there is really what you want to be doing in the future. Use social media carefully though. There's a lot of fake stuff happening everywhere, including in programs. And not fake because we're going to be lying about things, but not necessarily what they're doing there. So reach out to people. When you see that post, when you see that something and it just doesn't seem right, reach out to the residents over there and say, hey, I see that you guys are doing really fun stuff in there. What's going on? How can I get more involved? If they have meet and greets, do meet and greets. If they're offering to actually follow their grain rounds for like special grain round or whatever, join them in grain rounds. Of course, we understand that if you're not showing up to grain rounds every week, it's because you're busy. And I expect you to be busy in medical school. So it's not that we need to see your face all the time. But if you stay in touch somehow with the program, especially the programs that you're interested in, it should be a good thing. And you have to really understand if that program matches your goals. So let's say that you are a very academic, research-oriented person. Are you going to be in the right place if you go to a community hospital without any research and without any academic involvement? Probably not. If you're not academic at all and you're going into a place that does basic science research or encourages you to take time off for research during residency, you're not in the right place either. So you have to realize what kind of program matches you. I understand that we apply to every single program in the world because we want to figure out, we don't know if we're going to match or not. True, but you also don't want to be miserable. So if you're going to match into a place that doesn't match with your goals, it's probably better to actually wait for next year to match into a place that will actually fit you better. So finding the right place, a lot of people say, oh, do you have autonomy? I love you guys' autonomy there. What is autonomy? Autonomy without guidance is bad because you're doing the wrong thing for the patient. And you don't even know that you're wrong. So the right thing is graduated autonomy, graduated responsibility. When you know what you're doing, you get to do more. When you know what you're doing, you get to do even more. And you always have somebody to back you up. So do not be fooled by these autonomy programs that you just do a lot of things on your own. You're just left in the county hospital by yourself without any guidance. because it might not be actually a great thing for you or the patient. Also, volume is on everything. If you go to a place that you do 100 free flaps, they do 100 free flaps in a month, but you get to do the fourth assist in that free flap, it might not be the right place either, because you're really not getting to do the operation or to be the first assist or the second assist in the operation. So really looking into those fine details, again, talking to people. Ask about what the educational and conference program is. Ask about the faculty involvement in education, how interested they are in forming you as an amazing plastic surgeon, how people interact, the attending interaction with the residents among themselves, the residents with the staff, the residents with the medical students. Figure out how people interact to see if you're actually a good fit for that place. And also the diversity of cases. You don't want to go to a program that all you do is breast reconstruction. All you do is cleft. You want to make sure that you are a well-rounded plastic surgeon, that if you want to do a fellowship afterwards, great. If you want to do a fellowship afterwards, you're ready to go. Find a support system. I talked about my husband before. He was my support system since I got here. It doesn't have to be your spouse. It can be a friend that is going through the same process as you, or went through the process, or is going to go through the process in the future. Remember that you guys are not competitors. You guys, even if you're in the same year, you're not competing amongst yourselves. You can help each other get to where you want. This is a match. So even if you're in the same year, if you're actually interested in the same places, it doesn't really matter very much, because that program might like you and not like your friend, vice versa. So when I was a prelim resident at Mayo for my first year, we were 18 prelim residents and 10 categorical residents then. So in the beginning of the year, I guess I'm Brazilian, so that's probably why. I said, hey guys, we shouldn't really compete for this spot. So usually they would actually get one position and accept that person for the following year out of the 18 prelims. So pretty much they would we would do the first year prelim, and then one of these people would actually match into the first year spot the following year. I said, we have two options here. We can either get together, work hard so we can overcome all these difficulties, because most of us were IMGs, and we can figure out the system, we can figure the system out, we can figure out the English, we can figure out all those things together and help each other. Or we live a really nice year, or we can be miserable for a year, competing with each other for one spot that might not be ours at all. So we took the first route with a really large group of us. We were 8 people that just decided to just get together and stay together. And all 8 of us had really successful endings. Not that the other ones necessarily didn't, but we had a great fun year. So same thing, find a partner in crime that will just be with you through this thing, somebody who's interested in plastics or in something else. But find a support system. When you're writing a personal statement, somebody can read it. When you're going through the interview process and you're not really getting a bunch of interviews, then you actually have somebody to cry or to get to cry with, or to get encouragement from. So just find whoever that is. Your family, of course, too. When you're preparing your documents, write a personal statement earlier. I know that a lot of programs say that they don't look at the personal statements. I read all of them. And that's because I want to see through your eyes who you are. First and last paragraphs of your personal statement are the most important ones. No question about this. That's not me telling you. It's research telling people. If the first paragraph is catchy, I'll read all of it. If the first paragraph is not catchy, I'll jump to the last. Very honest. So write your personal statement. It's about yourself. You do not have to come up with this dramatic story of a family member that died, and that's why you actually got interested in plastic surgery. You don't have to create drama. You just have to talk about yourself, who you are. Update your CV. As I said, write about your interests. When requesting a letter, send valuable information. You can send your personal statement if you want to. You don't have to. Send your CV. When you're signing up, ACAPS has a letter that we actually mark where you are in percentile. send that to, make the life of the person writing the letter easier. So send all the appropriate information, send when the letter is due. It's like, really appreciate you actually writing this letter. This is my CV, this is my ACAPS form, this is my ERAS number. Please let me know if you have any questions. The application is due this day. Okay, make the life of the writer easier. So keep in mind, focus, but look at the surroundings as well. Work hard, ask for advice, ask people around you, go to your support system. There's no giving up whatsoever. However, you can change the focus to something else. If you think plastic surgery not for you, and you found that out later, it is okay to change it. You don't have to explain. You just have to tell people why you did it. If you actually got interested in plastic surgery later, it's also not a problem. And also, if you realize that you might not be the strongest candidate for plastic surgery now, you might go a different route. You can do general surgery, you can do something else, and you can do plastic surgery afterwards. So you can change the focus, but do not ever give up. Best of luck, and I'm open for questions. I know I have a very long talk.
Thank you so much. So if anyone has questions, you can either write them in the chat or just like unmute yourself and ask any question you have.
I'm going to go ahead and chime in. Thank you so much for giving us a talk today. I'm sorry I was late. I was doing surgery and trying to get home at the same time. And as you know, it all goes together in this being a surgeon mess and trying to run a webinar at the same time. And Isabel's done such a wonderful job. And so this is we're just starting as far as the Latina Plastic Surgery Society. And really what we want is exactly what you've presented, it's and just the part of your story and your perspective is so valuable, especially as a program director. And I know everybody here values that, right? And even though it's a small group, people are dedicated and want to enter this field, and it's being recorded, and we'll make sure to share it. So I just the specific recommendations, I think it's so it's great to hear it directly from a program director who sees it, who trains residents, and because there's so much advice, as you mentioned, that you get, and it's just really great to hear it from you. So I definitely appreciate you being here today.
Thank you, not a problem, anytime.
I have a question. Thank you for your presentation, Dr. Maricevich. My name is Omar. I'm at the University of Minnesota. I'm originally from Texas. So my question was, how are the tokens going to be used this year? And also, what are some things you look for in letters of recommendation that stand out?
So the tokens are new for me, and I'm not sure if this will be used very well this year because I think we're still learning. Some other specialties have been using for a little longer. I think that the tokens should be used for places that they don't know you at all, but you're very interested in interviewing it. Because you shouldn't really be using the tokens for a program that people already there, because your CV is probably going to be already in that pile list. So I'll tell you a little bit of my piles, how it works for us. And for us, it's a little tricky because we have a very large group of attendings, but I want to make sure that everybody who's going to be working with them has a chance to screen with me. So let's say that I got 300 applications. I have a yes list, and these are the people who have really stood out during their OA rotations, the students from my university, and it's like pretty much my yes pile list. These people are going to be called for an interview, okay? And that's because I know them, and I know, the ones that they really stand out. Then I used to do screening. I can't give you the details on how I screened all the applications before, but I used to do my screening. I did use step 1 score in the past. And then I would actually have this pile of no interviews, okay? And we're using this criteria that we're not supposed to actually tell you because every program has a different one. But let's say that I have my screening, that's the no pile. And then we have a very large maybe pile. So the tokens, the way I see it, is that if you were in the no pile for that program, you're gonna go to the maybe pile. So that maybe pile will actually be distributed to all of my attendings. So I will review all of the applications, but each applicant will be reviewed by at least 2 attendings. So I have, let's say last year, like 100 applications being reviewed by 11 people. So each application is reviewed, and those applications are scored by the attendings. And that's how I get to, those people get from the maybe pile to the yes pile. Does it make sense? So the token will be important for you to coming from that no pile to the maybe pile. So you have a chance. I'm not saying that you're going to be in the no pile. I'm just saying that in general. So if you rotated with us, or if we know you from somewhere and all that stuff, and you're probably going to be in the maybe pile to go through the screening by everybody else. So you want to get at least to that maybe pile for most programs. And that's when the letters of recommendations come handy. So if you're very interested in going to a place, that letter of recommendation has to come not from somebody, but somebody who knows that. So let's say you rotated your home program and you're with Dr. Chowdhury, right?
Yeah, Dr. Chowdhury, Mohajan, I know Dr. Martinez.
Exactly. So yeah, I know Dr. Chowdhury very well because he was my fellow. So if I see Dr. Chowdhury's letter and then he says something like good, okay, did a fair job, that doesn't really stand out very well. And I know him, and I can pick up the phone and say, hey, yeah, the okay doesn't really sound very great. So the letters, we know how to write the letters that they will actually stand out. And what I'm looking for in the letter recommendation is this one thing that makes you stand out amongst all of the students that came through. I don't need to read in the letter saying the best medical student that came through. That doesn't, because the best medical student for him might not be the best medical student for me. But if he has all great things about your qualities, your personality, your skills in general, your knowledge, that's going to stand out for sure. So letters are going to be key. And if you actually apply to places and you're working with people that have trained in places that you're interested in going to, reach out to them and say, Dr. So-and-so, I know that you trained at Stanford. I'm really interested in that program. Would you mind reaching out to them if you think it's appropriate for them to know a little bit more about me? I do this all the time. That's not after you don't get interviews. That's when you apply. You're not going to be asking somebody to call 15 programs for you because it's not going to happen. But maybe each attending can call for somebody, or one attending can call for like 3 people. And those for those specific places that you're actually interested in going to, at least for an interview. Did that answer?
Yeah, thank you.
I have a question.
Sure.
So thank you so much for your talk. I'm actually a 4th-year general surgery resident, but I have a question kind of along the, letters of recommendation line. So I've been, the application opens up, I think, next week. So I've been working on getting everything ready. And for my letters of recommendation, I have a plastic surgeon that's writing me a letter. And then I've been kind of debating whether I should have surgeons from other specialties write the other letters, because I've had surgeons that have reached out and actually offered to write letters that I've worked with a ton, but they're not necessarily plastic surgeons. And then, of course, I did my elective on plastic surgery, where I spent 2 months with various plastic surgeons, one of which is the one that's writing me the letter, and then others that I didn't get to work with as much. So I don't know what would be more valuable, or what I think, a program director might look at as more valuable. Someone that maybe I worked with a ton more in a different specialty, or someone that is a plastic surgeon, but maybe I didn't get to work with as much.
So I think that You can do a combined letter as well, if they're comfortable with that, because you can actually have a couple of names, and that's actually valid for everybody. So let's say that you didn't work very much with that person, but that name is the name that people know about, but you didn't really work very much with them. You can actually have a combined letter. So get the plastic surgeon that you work with, say, hey, if they're in the same group, of course, do you think that Dr. So-and-so would feel comfortable with actually writing a combined letter? Or ask that the other person. That would actually be helpful because you have two names in there. Make sure that you put when you assign that letter to a name, you put the name of the person you work with the most. Not with the most famous one, but with you work with the most. I think that having a letter from your program in general surgery is extremely important because it speaks a lot for who you are now as a resident. So it's a little bit of a red flag if you actually don't have a letter from your program. Because that means that, like, what have you been doing for the last 4 years? So have a letter from either your program director or your chair or somebody who we worked with a lot in your program right now. And I think that using like an orthopedic surgery letter, or I'm not sure what other specialties, if they have some kind of correlation with plastic surgery, I think it's fine, but it really has to talk about certain skills that you have that again will stand out. It can't be just a general letter that you're a great resident, because like if an orthopedic surgeon is telling me that you're a great resident, what does that mean? Like that how to put, like, I don't know, nail and screws in a hand, that's not really gonna cut it. Like if you have a laparoscopic surgeon talking about your laparoscopic skills, might not really be the best thing that you can get, but you can talk about your general surgery skills, like that your technique, your professionalism, your punctuality, your performance in general as a resident caring for the patient. So you have to be something. Whoever's writing the letter has to make you stand out somehow. The other thing that you can do, because now it's a little different for the students, but you can actually have people writing letters talking about certain things about yourself. Let's say that you did research with somebody, just throwing out there. One letter can be talking about your strength in research. And then you can specifically ask the person, I know that we haven't worked together very much in the operating room, but I've taken care of your patients for you. Can you emphasize on my professionalism? So then you have 3 letters there. Each letter is talking about a specific quality of yourself. It's a little bit harder for medical students to do that because you usually don't have this openness with the attendings that you're working with to say, can you write about this? You're still learning what you're good at. But as a resident, I think you can actually ask them to pinpoint your biggest characteristics. But not a problem when actually getting other specialties right for you.
Oh, thank you.
Sure.
I have a question. Hi. Can you hear me?
Yes.
Hi, it's a pleasure meeting you. My name is Giancarlo Rivera. I'm a 3rd-year medical student at UCC School of Medicine, Puerto Rico. So I have a question regarding, like, for example, we don't have a home plastic surgery program over here.
Yeah.
And I feel like that is one of the biggest deficiencies that we have, because I just came back actually from doing a research here from Dr. Purvish and Dr. Persing at Yale.
Nice.
One of the things that I noticed was that many of the rising 3rd years and 4th year have a lot of things down in terms of not so much research, but what do they need to do when they do those sub-Is? So my 2 questions are what is expected of me as a 4th year sub-I, and what do you think for people like me that don't have a home program? What do you think is your biggest recommendation for us?
Yeah.
Thank you.
So I kind of touched on a couple of things about in their ways. You just have to, and I've been there, right? So you just have to really work harder because you don't know what you don't know, really. So when you get to these places, you have to learn about the patient before they actually learn about the patient. You have to figure out what they're going to be doing the operation on. You still have access to everything else that people have access to, but you just don't know where to find it. So reach out to the residents working with you and say, hey, I'm really interested about this case, in learning about this case. Or like, what are the cases for the week? Which one should I read more about? So you're gonna really have to reach out to people to actually know about this. About the home program though, I also touched upon that for a little bit. ACAPS does have an orphan pairing program. So you can go to ACAPS and to the ACAPS website, and they actually have there a way for you to sign up for this program that you just put your name in there, you put institution, and they will actually pair you with attendings and sometimes residents from other programs. They would actually give you some guidance. As I said, like I have 2 mentees that I help with through this program. A lot of times they will actually match based on geographic location, a lot of times based on interest, a lot of this time just based on availability. So I think that this is actually a great place for you to actually reach out to people too, right? You're third year, they're fourth years here. Figure out with them what they did, how they actually survived their rotations, what struggles they had, so you don't have too many of those struggles afterwards. It is true there is a big disadvantage not to have a home program for your learning, because as I said, who are you going to talk to about this? Like everything is going to be outsourced anyway. But it's also a time to shine. Our current resident here, our second resident here this year, she did not have a home program, and she started this little interest group in her program, and she just started reaching out to people. She started this little thing that became pretty big, and then that's all she talked about in the interview, right? Like she started something small that for her was a big deal, and for us was a big deal because she started from scratch. So you find your little way to shine within your place. Let's say, I'm sure you don't have a home program there, but there are surgeons in the community that actually work there, right? It's plastic surgeons. Reach out to them. Hey, can I join you for this? Or when you come here to the hospital, can I join you for the surgery? And what have you been doing lately? So it's not that you don't have plastic surgeons around you. It's just that you don't have easier access to them in an institution. Which in one way I should speak for myself, but I expect a lot more from somebody who actually has a home program, because if I see somebody that has a home program and they have nothing in regards to research or clinical experience within their people, it's a red flag, right? Because I'm like, okay, you say that you're interested in plastic surgery, you have people to work with, and you haven't really produced anything. Unless you decided to do plastic surgery late, which is okay. Where have you been? What have you been doing? So.
Perfect. Thank you very much.
Absolutely.
Oi, doutora, eu também sou brasileira.
Oi, tudo bom?
Oi, my name's Priscilla. I was just telling Dr. Maricevich that I'm also Brazilian, but I actually grew up in Houston, Texas too.
Oh, nice.
I'm a current rising M4 at Dartmouth, and I'm taking a research year out at Stanford. And one of the things that I'm a little bit unsure about is just how many research publications I should be aiming for, or I guess productivity in terms of this year. I'm not here through an established program, and I'm just kind of working with an attending and a couple attendings. So it's very much kind of geared on, my own productivity. And I feel like I don't really know what I should be aiming for in terms of research.
I don't know either. So it's a little different now because the application process is changing. So when I look at somebody's CV and I see 80 publications, I'm like, wow, that's way too much. So I look at what they wrote about, and it's a bunch of things that they're really not scientific, like time little case report, something that is like not really leading plastic surgery pretty much anywhere, right? So more than the number is the quality. the ideal is that you have one or two really good research projects that you started, you did it, and you finished. Then you have to say with pride, I did this whole thing. So the idea is, of course, sometimes you have to get into a research project, but like you really did the real work. So more important than the number is the quality. I've had people that came with 3 papers and the papers were absolutely amazing. The good thing about the new application process, which some of you might know about, some of you might know about, is we used to do ERAS only, right? Everybody would apply through ERAS, and now we are using PSCA, which is the Plastic Surgery Common Application. And the Plastic Surgery Common Application is actually free. You don't have to pay for it. I think from next year on, that's all we're going to use. We're not going to use anything else. But the PSCA, you actually have the chance of putting your most important projects. Because in ERAS, everything gets mixed up, like in the ocean of projects or like volunteer work and all that stuff. Now you're going to have the chance to actually just identifying what you think was the most important work for you. And I think it's awesome. Because again, you don't have to have 100. So I don't really have a number. Like when I look at something, I would expect, 3, 4, something. It doesn't have to be first authorship. It's nice when you actually have first authorship and also second or third, because it also means that you're actually working with the team and we were collaborating with people. I actually think it's a great thing to have. But the quality is more important. A project that you thought through and you did the data collection and you came up with a result is more important than 10 case reports.
Obrigada.
Matt?
I have a question. My name is Maggie Fondani. I'm at Rutgers, New Jersey Medical School, just like Isabel, but I'm a 3rd year. So the process of forming the application is starting to become very real for me. Thank you so much for the talk. I think one advice that I receive is starting to craft narratives for an application, things that people can clearly see. I was wondering if narratives are things that some kind of narrative is something to look for in an application, and if so, what kind of themes stick out to you and how to aim for them.
Are you talking about the application in general or personal statement?
The application in general, but a personal statement is a component as well.
Yeah, I don't know. I don't think that I really look for narrative. I think I like diversity a lot. So I don't really necessarily look for, I don't, but I guess it makes sense. The thing is, like if there's no narrative at all, for example, if you have one research project in ortho, one research project in neurosurgery, one research project in pediatrics, one in this and this and that, and there's no like idea who you are, it's tricky. But I actually like when I look at an application and I see not a little bit of everything, but some things that talk about yourself. Let's say, I talked about the interest part, right? So when I see in an application that the interests are all about, I'm a marathon runner, I did classical piano and I did this, I won this award in this, and I climbed Mount Everest, whatever it is, I'm like, wow, this person is like super high strong. That's a big narrative. I actually do not like seeing that, because is this person going to be just focused on like being like that's all they want? I don't like that. I prefer somebody, the narrative. I think that I don't like narratives in general, because I think it's almost like that you're trying to create something that you're not. I like seeing an application who you are. If you're interested in football, fantasy football, that I had no idea what it was until 2 years ago, but I spent 15 minutes talking about it with an applicant. That's who you are. Talk about fantasy football. I want to see the passion on you. If you're trying to create a narrative in your application, that's my personal opinion, You're trying to create something that you may not be. So same thing for personal statement. Do not try to come up with something that like, oh, you know, it was one day. It can be, and it's fine if it is, but you don't have to go back to your childhood to figure out that one day that you decide that happened something that you decide to be a plastic surgeon. Just talk about yourself, be yourself. So I'm not a big narrative person in general, because I'm very transparent, and I think that you actually, that's why you have to do an application. You have to show who you are.
Thank you
Sorry,
so much.
I probably didn't help about that, but
No, it's good. It's good. I like to hear that because I get opinions from a lot of sources, and knowing what's like one's own opinion versus what actually is in the field itself is really helpful. So thank you.
for sure.
Well, I think we're past the time, and I know it's late in Houston and the rest of the United States. And so I really want to thank you so much again for coming and speaking with us. I want to thank all the students too. We have put out a form there for people to fill out if they'd like, just to stay involved, and so we can collect emails, honestly, with the Latino Plastic Surgery Society. And so we can continue these conversations with mentorship at these different levels. And so it's all, you know, we all have our trajectories, right? And so thank you for being another, you know, helping us get in the right direction. So definitely appreciate your time today.
For sure, absolutely. Thank you. Best of luck to everybody. And I'll see you around very soon, right?